So I will call the meeting to order. And I can certify that the open meeting law requirements have been met with notifications and posting. And we are on number 3, public comment period. If there's anyone out there in the public that wishes to speak, you can call in. And the number is 715-538, I believe 1770. Doesn't look like. Again, I will ask if there's anyone out in the public that wishes to make a comment. Please call 715-538-1770. You can forge my name if you want.
It's a little bit late in my career to start forging your signature.
Does everyone have an agenda?
Thank you, Deb. I have one.
Third and final call from the public. If anyone wants to call in, 715-538-1770. Since I don't hear the phone ringing off the wall or the desk, I'll close the public comment period. And then we can move on to number 4, the approving of the agenda.
I'll make a motion to approve the agenda with the understanding that we would like to move items 6, 7, and 8 to after item number 10.
Is there a second to that? Okay. Motion by Baxa and a second by Johnson to approve the agenda with moving items 6, 7, and 8 after number 10. Any discussion? All those in favor of approving the agenda as amended, say aye.
Aye.
Aye. Opposed? The agenda has been approved. Carol had sent out the May Board of Health minutes. We need a motion
Move to approve.
and a second.
A second.
Okay, a motion by Johnson, a second by Miller to approve the May Board of Health minutes. Any discussion? All those in favor, say aye.
Aye.
Aye. Opposed? The minutes have been approved. Then we will be skipping down to number 9. Barb will give a review and update on the department issues with, we had talked last month about tabling the COVID immunization policy for minors. Did we officially table that? That we have to bring it off the table? I don't remember, and I didn't bring my copy of the minutes. Update on communicable disease and distribution of the workload. Carol, do you remember in the notes in the minutes if we tabled the COVID immunization policy or if we just said we were going to talk about it next month?
It says in the minutes, we'll discuss and table it for next month.
Okay, then we need to bring it off the table. If someone would make that motion to bring the COVID immunization policy for minors off the table.
I will make that motion.
And a second? Okay, a motion by Johnson and second by Baxter to bring the COVID immunization policy for minors off the table. All those in favor say aye. Aye. Opposed? So Barb, fill us in on the latest.
Okay, I just want to know,
if you feel, right now, our immunization policy from the health department requires minors to be with their legal parents and to be able to show identification. Picture ID, copy of the child's birth certificate, so that we know child A belongs to parent A, type thing. And that is fine, and it's something that we have been working with here in the health department. The question then becomes, is that under the rules that the state is sending down for the COVID vaccine, they are not allowing us to ask for any identifications whatsoever. And my question to you is, do you want to put a line in the policy making an exception for epidemics and pandemics, or you just want to leave it as is and we'll just run with the current policy from the state?
So state again what,
Okay.
Bill, is your microphone on?
Barb, could you delineate what you're suggesting?
Okay, there are two choices. One, if we keep our vaccine for children policy the way it is, it would require us to ask for identification from parents for when we vaccinate anyone under 18. COVID regulations for vaccinators do not allow us to request any identification. So the question is, that's the way it is. So the question is, do we want to amend our vaccine policy to make an exception for an epidemic or pandemic, or do you want us just to continue what we're doing, and that is kind of going with the state and not asking for identification for minors?
I would recommend that we have identification for minors like we've had in the past, and with a legal parent here too. You're going to open up a can of worms if a 16-year-old comes in and says, I want a vaccine, and no parent is here.
Okay, well, the state does say that they have to have parental permission, and it gives several different ways in terms of obtaining it. But there is a line in one of the policies that says that we cannot ask for identification. In other words, under our present VFC, Vaccines for Children policy, if I bring Carol in for a vaccine, I have to show you my identification, I have to show you her birth certificate showing that Carol is my kid. Okay, we're not allowed to ask for that under the current state and CDC rules for COVID vaccinations.
Have you talked to Rick about this?
No.
Okay. I think going contrary to what the state and other guidance would be is probably something we'd need to find out, that if there was some sort of an objection or a lawsuit, that the insurance company would cover us
Okay.
in a lawsuit, because
Yeah, well, we're following right now on the COVID what the state is telling us we can do.
right,
It
so-
just does not exactly match our Trempealeau County policy. Because our Trempealeau County policy says we have to ask for identification. That's the difference.
I'm not a medical provider, so I don't know. I mean, that is outside of my skill set, and so I definitely would defer to those on that. But I do think that we should consult with Rick before, just to make sure that should something happen and should somebody file a lawsuit, that our insurance company has provided guidance for us, which if we follow that, then we're protected.
Okay.
I would agree with, I am a medical provider. I would agree with what Sally's saying, though, because if we depart from what this, I don't know how historically that happened, that the Trempealeau policy is at variance with the state. And I know that in a clinic, we don't ask for a birth certificate. We ask
No.
the person, it's in good faith, that the person says, I am the parent of this 15-year-old or 16-year-old, and that's what we go with. But I would run it definitely by legal counsel on that.
Okay.
So table it for next time, or?
Or just continue the discussion next time.
Mhm.
So we'll just put this on the agenda for next month and checking with legal counsel
And have a
which way to go.
response.
Okay.
Okay.
We won't officially table it, we'll just put it on the agenda. So updates on our communicable diseases.
We've had 3 recent positive COVID cases. That brings us back up into the yellow category, but for the most part, we didn't have any last weekend. We're doing good in terms of COVID. Vaccines are down. We're just getting a handful. We have been doing vaccines out at the annex, and right now we're discussing just bringing them back into the health department rather than setting up at the annex. We have a storage problem which we have to work out as far as equipment goes, but that's minor. Jeremy and I will argue that one out.
Any other communicable diseases out there?
No, they all disappeared with COVID. No. That's not true. If you look, I wish it was. If you just look at 2020, waterborne diseases like crypto and giardia, there were 18 of them. Foodborne ones like E. coli, Campylobacter, Salmonella, there was 23. STDs, there was 115. Blood or body fluid associated ones, there was 24. Vector-borne stuff like Lyme, ehrlichiosis, anaplasmosis, babiosis, there was 32. There was 289 influenza. We had 326 miscellaneous communicable diseases. COVID is not included in any of the numbers I just gave you. We had that were positive, and this was only with the positive confirmatory test. It doesn't count any of the probables that worked in with antigen testing or anything like that. We had a little bit under 3,000. The number is 2,979 positive cases. Hospitalized, we had 97 in our county. Unfortunately, we also lost 29 of our residents to COVID in terms of dying from it. And the total cases that we in the health department dealt with regarding COVID was 10,539.
Any questions?
We were busy.
Yes, I was going to say. Distribution of the workload. I know Barbie said you've been delegating
Yeah.
some things.
What I was trying to do is to try to make life as easy as possible in terms of continuity as we go forward here. So I made a list of a lot of the things that I have been the leader on in the department, and I am naming another person to join me as a leader so that we have a second person on everything. An example would be the Compass, which is a community assessment that we work on with United Way. Kayla is going to be the second on that one. Traffic safety, that I am, well, I'm the note taker, so I don't know if that makes me the secretary or not. But Jessica is going to be taking over that. She has substituted a couple of times. But anyways, I went through all of the things and the committees and stuff that I am on, and I'm in the process of naming a second person to go with me to the meeting, so we have, trying to do a smooth handout. I just wanted to let you know what I was doing.
Anything else?
That's all I had.
Wow, if we didn't have the closed session here, we could be done in a flash. Yeah. So Carol's up for reviewing the agency vouchers and the budget, and she's been dealing with the auditors, so she might want to talk about that.
We'll go through this sheet first. This is just the summary from our last Board of Health meeting. Total vouchers paid was $8,113.78. As you can see, our COVID expenses are, it's going, oh, I'm sorry, that's okay. Our COVID expenses is going down, which is a good thing as long as well as our US cellular bill is going down too. I can't really say that there's anything that I'd like you to really discuss. Nothing really new. But I do not have the agency report ready for you today from January to present because I was with the auditor for the past 2 days. And what's going on is we're having a confession time of the year 2020 as far as financial stuff goes. So they're doing what they're calling like a testing, and I think that's to prepare us for if there's a bigger audit coming, so to speak. Just to throw some numbers out to you, in 2020, I had sent expenditures to the various, to the state as well as to your FEMA for all of our expenses. So from the health department, $365,198 was billed out and brought in. So that means that much money is off of levy. So yeah, it was a lot of work. It was our time. But again, that took that amount of money off of levy. So far for 2021, I billed out $174,299. What's happening is with the revenue part of what was billed out, that is checking out fine, as well as the expenses. Now we have to figure out a way of how to prove our expenses. So I work with 3 different programs, which I can't do a nice little neat summary, hit a button to go, because our time studies is done with an Access space, which helps me prepare a lot of these reports and cuts the time down for the staff, meaning they're employed for the county. So that's one area. Then all the contract chasers, all the interpreters, anyone that gave shots that's not an employee, that is done through the voucher system, which is what you good people fill out, which I put that into a different Access program and try to pull reports out to report these expenses. And then we have our equipment and all of our gowns, our supplies and all that. That's done through another way. So what I have to do now is prepare an Excel spreadsheet showing the expense, showing the person, what date they worked, what hours they pulled in, and the amount of money. Then I have to take all these papers and I have to scan it in and I have to send it to the auditor. So $365.98 is what I will be doing to get that accomplished for our auditors.
It's probably not something you've ever experienced before. Disasters are like that.
Well, actually, we sat down to thinking, how can we do this in every way that he was used to from other counties to show? We can't do it because our bookkeeping system is different. So I thought of it that, yeah, it's more work for me, but I would rather do it and be able to explain it than to try to explain it to somebody that to do it, it's just like, forget it, I'll do it. So that's why you don't have your summary for for the year.
Been in emergency management and disaster response long enough to know that it's imperfect when it's perfect. And thank you. I know that it's definitely a lot more labor than.
Well, just in looking back, it's kind of like a fog. What really happened?
Yeah.
So, but anyway, that's all I have for you tonight.
Thanks, Carol. Then we are going to move back up to number 6 to have a closed session. So we need a motion, and if whoever makes the motion could read the full verbiage.
Make a motion to go into closed session for Wisconsin statute 19.85. 1C to update the committee and consider employment, promotion, compensation, or performance evaluation data regarding county personnel issues, including review of applications for Director of Public Health Officer position.
And a second?
I'll second that.
Okay, a motion by Miller, second by Johnson to go into closed session. We'll do a roll call vote. Killian will start with yes.
Miller, yes.
Baxa, yes.
Johnson, yes.
Miller, yes.
Okay. It looks like everyone is approving that. Is Carol staying for this?